So, hello, me again, sorry. My name is Emmanuel. I'm a Dermatology Advanced Nurse Practitioner. I'm also someone that has lived with psoriasis as well. I'll try not to teach you all to suck eggs, but just some general tips from myself as a dermatology nurse that I'm sure most of you do already. Maybe you might hear it and think, oh, that's a good tip. I might do that going forwards. So over the years, I've worked in several NHS different trusts and obviously lived experience myself. And I'd like to think that I have in that time picked up one or two tips that make it all worth it. So I'm not going to focus really on the complex science. I think we had a great talk about the latest medications, which is brilliant. But I'm going to talk more about just some of the everyday challenges and the opportunities that are available to all of us, and hopefully some simple solutions that can help you get the most out of your psoriasis care. Is that working? Yay, no strobe yet. I've gone through, because obviously today there was like kind of a slogan around challenges, opportunities and solutions. I've tried to break it down along those lines as well. So we're living in a really interesting time for psoriasis care. On one hand, there's still significant challenges. Psoriasis is a chronic condition. It can be unpredictable and it can be frustrating. It can affect work, relationships, confidence, quality of life. But at the same time, there have been so many more opportunities available. We have more treatments than ever before, better research, better awareness, better patient organisations, and better support networks. So ultimately, hopefully, today my message is going to be around about optimism. So living psoriasis hasn't always been easy, but there are many practical things that we can do to improve outcomes and make life easier. So, challenge one. One of the most common things I think we tend to hear is nothing works. I've tried everything. My psoriasis always comes back. And I do completely understand why people feel that way, as I've been there myself. Psoriasis, by its nature, can be very frustrating and unpredictable. Even when treatments seem to work at times, the condition can often return. But there is an opportunity. Many treatments don't necessarily fail because they're ineffective. Sometimes they fail because they're difficult to use consistently. Life might get busy, people forget applications, products are messy and routines change. And if you're anything like me, you've sat there before work on your dining table like that, covered in emollient, trying to get it to absorb in before you put your clothes on. Yeah, lots of nodding heads. And then cover yourself in instiller that you're not supposed to do, but it's the only thing that works. But the opportunity here is to really understand what the treatment is for, and to be honest and to have open conversations with your dermatology team. The worst emollients are the ones that you don't actually use. If you don't like it because it's too sticky, let us know. There's workarounds, there's different consistencies we can do. Also, it's good to inform yourself and educate yourself about how long these products tend to work. Sometimes it might be a bit of an unrealistic expectation there. Emollients and steroids still do take some time to work. Also, make that treatment part of your regular daily life. So some tips around that. I've previously found that if I leave my emollients by my toothpaste, I'm more likely to remember it as well. So think about where you put it. Many treatments are prescribed many people are prescribed creams and ointments without necessarily fully understanding what they do. So moisturizers help to support the skin barrier. Steroids, for example, can help to reduce inflammation in the skin. Vitamin D products may also help slow down that rapid turnover of skin cells that occurs in psoriasis. And sometimes you can get combinations of products that do both of these things. When patients understand why they're using the treatment, you're more likely to use it consistently. So please, please, please don't be afraid to ask questions. If you're scared to ask the doctor, ask the nurse. If you're scared to ask the nurse, ask the doctor. We will be able to give you more information about how these work. Make sure you understand what a treatment does, how long to use it for, and what success realistically looks like. Something like a moisturizer will always be the cornerstone of treatment. Even once you're on established treatment, you should still be using a good moisturizer. The more you understand, the more control you can gain over your condition. Consistency, convenience, and confidence are key. Another point now around making the most out of your appointment. So I waited 2 years for my appointment and then it was over in about 5 seconds. It can be very difficult to remember what's going on. So think about your clinic appointment. You may have waited weeks, months, or even years to see the specialist, and suddenly you're sitting right there in front of the appointment. They're saying lots of words that end in mab, and you don't really know what's going on. we've all had that experience and walking out and immediately thinking, I forgot to ask the question. So preparation is really key. Write down your questions before you get to your consultation. If you're prepared, you can get so much more from your appointment than somebody that just arrives and see what happens. So please, please, please write down your questions beforehand. We know that appointment times are getting shorter and shorter. If you're lucky, you might be able to get 30, 45 minutes. If you're very lucky, it's not unusual in some trusts to now go as low as 15 minutes because they need to see as many patients as they can. So try and also prioritise the questions that you have, the questions and concerns, so that you can make sure that your key ones are answered so that you can improve your care. How to prepare for your clinic. So before your appointments, take a few pictures to prepare. Psoriasis naturally goes up and down, it waxes and wanes, and we don't blame you when you turn up to the appointment saying it's been really bad but I'm clear today. That's not unusual for that to happen. So make sure you're taking pictures of when your skin is severe so that we can see that and help you. Write down those questions like I said. Make a note of treatments that you've tried at home, often particularly if you're coming at that interface between GP and into the secondary care settings, so hospitals. You've probably tried so many different treatments. Think about side effects you've experienced as well. Think about what creams you have liked. Have you liked more watery lotions, or do you quite like thick creams? It's not unusual for, say, in summer when it's very hot and stuffy outside, you might prefer a lighter cream. Just let us know so that we can make sure we're prescribing the right things for you. But don't just focus on your skin. Tell us about your sleep. Tell us about itching. Tell us if psoriasis affects your work or your confidence. We'll hand you something like a DLQI, which you saw earlier, which I'm sure you've probably filled before with the tick, 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 tick. But make sure you answer it honestly so that we can probe a bit more and try and support you. These things all do matter. As healthcare professionals, we know that we don't just treat the skin, we treat people. The more complete picture we have, the better we can help you and signpost things. An important one, we've mentioned about psoriatic arthritis, but really don't ignore joint pain. One thing that concerns us that many people focus entirely on their skin and sometimes ignore other symptoms. Particularly young males might think, oh, it's just a sore joint because I was at the gym the other day, that's all part of it. But it's important that you do let us know. Psoriatic arthritis affects a significant portion of people with psoriasis, and unfortunately many people do assume that aches and pains are simply part of getting older, which isn't necessarily true. So it's important that you tap in and explain to us any pains you've been getting, because you might not realise that they'd be linked to psoriasis. So it's roughly around about 1 in 3 people with psoriasis may develop psoriatic arthritis. That may manifest as things like morning stiffness. So I always say, do you jump out of bed like a spring chicken, or does it take you a bit of time to warm up to get out of bed? Any obviously hot swollen joints, big red flags, or toes, or heel pain, all of this would warrant an assessment. Information overload. We talked about social media, it's what I spend a lot of time talking about, but we live in a world of unlimited information in our pockets. Social media is filled with advice about psoriasis, the good, the bad, the ugly. Some of it is excellent, some of it is less helpful, and some of it, quite frankly, is complete nonsense. I regularly see miracle cures, detoxes, expensive supplements, and treatments promising to completely eliminate psoriasis online. So if somebody had genuinely cured psoriasis, I guarantee you it will be front page news. So at the moment, there is not a cure. But if you are having information overload, please do tap in with places like the Psoriasis Association when they've got their forums online. And ask your dermatologist. There's regular research that says that though we know that people are using social media to access information, they're too scared to bring them up in consultations. I think it is useful. I personally wouldn't be mad if you showed me a video you had seen online and asked me to discuss it, because I think it's important we have those critical conversations. But don't feel too overloaded with information. Reach out to your healthcare professionals. Along that theme again is finding reliable information, is knowing exactly where to find trustworthy information. And again, the Psoriasis Association is one of the best resources available, particularly for psoriasis. They provide evidence-based information and educational materials. The NHS is obviously another excellent resource. The British Association of Dermatologists also produce high-quality patient information leaflets that are openly accessible. Whenever you read something online, always ask 3 questions, and that is, who wrote this? What evidence supports it? And are they trying to sell me something? I think they're 3 very important questions to ask yourself, and that helps you discern exactly what can be trusted and what can't. Being informed doesn't mean believing everything that you read. It means learning how to identify reliable information. So if you take one thing home from this slide, those 3 questions, whenever you see something online or a nice video, just question them. Reasons for optimism. Now just switch it into a positive. If you had psoriasis 20 years ago, as Hamish nicely put, the treatment options were so much more limited than they are now. Today we have better options than ever before. We understand psoriasis so much better. We've got more specialist nurses than before, more biologic therapies and more research going on, and more importantly, better patient organisations. There is still a lot of work to do and genuine concern, but there are genuine reasons to feel optimism about the future of psoriasis care. So my 5 quick take-home solutions. If you remember nothing else, please remember these. 1, moisturise regularly. Sounds simple, easy to forget. 2, use treatments consistently. And if you're not being consistent, be honest with us. Tell us as healthcare professionals, because we can try and understand why and adjust your treatment plans to better meet your needs. Number 3, prepare for your appointments. Preparation is key. Take pictures before of when things are bad. Note down. Tell us if you've got any upcoming events, because sometimes that can actually affect the treatment that we're offering you. Number 4, report joint symptoms early. The earlier we can detect them, the better we can get you on the best treatment for them. Number 5, use trusted resources, information and support. And I think that these small changes taken together can genuinely make a surprisingly big difference to you and your psoriasis journey. Thank you very much.